Hey everyone out there, it's Miki again, and this is another hand question of the week. It's number 25 in our series of questions for medical students, residents, and fellows who are studying for the boards or in-training exam. It's October 16, 2024, and let's get right into it. A boutonniere deformity requires an injury to not only the central slip insertion at the level of the proximal interphalangeal joint, but also an injury to the A. sagittal bands, B. triangular ligament, C. lateral bands, D. terminal tendon, or E. volar plate at the proximal interphalangeal joint. Well, here's your chance to pause the video so you can think about the question and answer it yourself. Boutonniere deformities are an acquired flexion contracture of the proximal interphalangeal joint. The most common mechanism is an injury to the central slip. The central slip is the insertion of the extensor digitorum communis at the level of the middle phalanx, just distal to the proximal interphalangeal joint. A central slip injury is not sufficient to produce the deformity. Injury to the triangular ligament is also necessary. Injury to the triangular ligament allows subluxation of the lateral bands from dorsal to the flexion extension axis of the proximal interphalangeal joint to volar to the flexion extension axis. The subluxation of the lateral bands causes the flexion deformity of the proximal interphalangeal joint and the hyperextension deformity of the DIP joint or distal interphalangeal joint. So let's show that in a drawing so that you can better understand that. What you have here depicted in the top part of the drawing is a normal finger. The purple tendon, or the purple line, is the central slip, and the blue line is the lateral bands. And these are depicted in their normal sort of orientation, with the lateral bands dorsal to the PIP joint and dorsal to the DIP joint. In a boutonniere deformity, you can see that the blue line moves palmarly or volarly towards the bottom, and they end up volar to the PIP joint but stay dorsal to the DIP joint. So this is what causes the deformity. But how did that get there? Well, to get or to understand that deformity, you have to see it from the top view or from posterior to anterior. And so we're going to draw that right now. So in a normal finger, this is what you see from top to bottom, or from back to front, from the dorsal side of the finger volarly. And what you see is the blue tendons are still the lateral bands, and the purple tendon, or the purple line, is still the central slip. And the red lines that you see across connecting the two lateral bands is called the triangular ligament. And that holds the two lateral bands dorsal to the middle phalanx and prevents them from subluxating laterally and then volarly. And so we're going to show in a little bit of an animation how the boutonniere deformity forms. Number one, the central slip ruptures. If the central slip rupture becomes subacute or chronic, that places pressure on the triangular ligament, because now the lateral bands have to do the work of the central slip to extend the finger. Eventually, in some people, the triangular ligament fails, and that's step number two. So that you can see there depicted by the green line through the red triangular ligament, it ruptures. And this then allows the lateral bands to, and depicted in number 3, to subluxate laterally and then volarly. So that's how you get from the top picture, normal, to the bottom picture of the boutonniere deformity from the lateral view. So hopefully that helps you understand how boutonniere deformity forms, and you understand how to answer the question. So the question's answer is B, triangular ligament, because in order to get from a central slip injury to a boutonniere deformity, you have to rupture the triangular ligament to allow for subluxation of the lateral bands. Well, hopefully you learned something. Hope you enjoyed the video. We'll see you at the next one. Remember to like and subscribe so we can continue to support this channel. We'll see you at the next one.